Welcome to another episode from the Veterinary Research Channel. Today, John and I are diving into a fascinating piece of research from the world of veterinary surgery.
That's right, Alex. We're looking at a study that investigates a new way to diagnose a very common problem in our canine friends. Injuries to the medial meniscus in the stifle joint, which is their knee.
Exactly. As many of our listeners know, cranial cruciate ligament disease is a major cause of lameness in dogs. And very often, when a dog tears this important ligament, they can also damage the menisci, particularly the medial meniscus.
And as the researchers point out, these meniscal tears can really worsen the pain and loss of function associated with the ligament injury, making it crucial for surgeons to accurately identify them so they can provide the best possible treatment.
Traditionally, the diagnosis of these meniscal lesions has relied on directly looking inside the joint, either through an open surgical procedure called an arthrotomy, or a less invasive keyhole surgery called arthroscopy.
But both of those methods have their drawbacks, right? The study mentions that these invasive procedures come with a risk of morbidity.
That's a good point, John. The researchers even cite a study that found iatrogenic cartilage lesions, meaning damage caused by the procedure itself, in a significant number of stifles following both arthroscopy and mini-medial arthrotomy. Interestingly, the lesions were often larger with arthroscopy.
That's something to consider. So, what are the non-invasive alternatives that the researchers were exploring?
Well, there are a few, including ultrasonography, magnetic resonance imaging, and a technique called positive contrast computed tomographic arthrography, or CTA. Historically, CTA in veterinary medicine has mainly used single detector technology.
And the study notes that while single detector CTA can help visualize the soft tissues in the stifle, like the menisci, it has limitations, especially in image resolution, which can affect diagnostic accuracy.
Precisely. However, in human medicine, multidetector CTA has shown excellent results in evaluating meniscal injuries. And now, this more advanced technology is becoming available in veterinary referral centers and larger hospitals.
So, the researchers in this study wanted to see how well multidetector CTA could diagnose meniscal lesions in dogs with cranial cruciate ligament injuries. Their hypothesis was that this advanced imaging technique would provide a clinically useful level of accuracy and strong evidence for identifying these injuries.
That sets the stage nicely for the study itself. Now, let's move on to what the researchers actually found.
Right. They conducted a prospective study involving client-owned dogs who were being treated for cranial cruciate ligament injuries. All the dogs underwent multidetector CTA scans, and then they subsequently had a mini-medial arthrotomy where the menisci were directly assessed. This surgical finding was used as the gold standard to compare against the CTA results.
The scans were anonymized, randomized, and reviewed twice by 3 independent observers with varying levels of experience. This is important because it helps to assess how reliable the test is, and whether the experience of the person interpreting the images makes a difference.
And after analyzing the data from 52 scans of 44 dogs, they came up with some interesting findings. The researchers reported the sensitivity and specificity of the multidetector CTA for identifying meniscal lesions.
For our listeners who might not be familiar with those terms, sensitivity refers to the ability of the test to correctly identify dogs that actually have a meniscal lesion, while specificity refers to its ability to correctly identify dogs that do not have a lesion.
Exactly. The study found that the sensitivity ranged from 62% to 100% across the different observers and the 2 readings, and the specificity ranged from 70% to 96%.
Those are fairly wide ranges. What about the agreement between the different readings by the same observer, and between the different observers?
The intra-observer agreement, meaning how consistent each observer was in their 2 readings, ranged from fair to good. The intra-observer agreement, meaning how much the different observers agreed with each other, was moderate for the first reading and improved to very good for the second reading.
That improvement in intra-observer agreement from the first to the second reading is quite interesting. The researchers also looked at how the diagnostic accuracy changed between the 2 readings.
Yes, and they found a significant change between the first and second readings for the 2 least experienced observers, but not for the most experienced observer. This suggests that there might have been a learning effect taking place during the study.
That makes sense. As the observers became more familiar with the images and what to look for, their ability to correctly identify the lesions likely improved. The study also calculated something called positive and negative predictive values.
The positive predictive value tells us the probability that a dog actually has a meniscal lesion if the CTA scan is positive, and the negative predictive value tells us the probability that a dog does not have a lesion if the CTA scan is negative.
The results showed that, based on the second reading, A positive CTA scan had a positive predictive value of approximately 90%, and a negative scan had a negative predictive value, ranging from 91% to 100%. Those are quite high.
They also calculated positive and negative likelihood ratios. A positive likelihood ratio reflects how much the odds of a dog having a meniscal lesion increase if the CTA result is positive, and a negative likelihood ratio indicates how much the odds decrease if the result is negative.
The study found that the positive likelihood ratio was at least 4.6, and the negative likelihood ratio was 0.08 or lower. The researchers note that these values suggest that a positive CTA finding gives a moderate to large increase in the likelihood of meniscal lesions, while a negative finding gives a large decrease.
And overall, the percentage of correctly classified menisci was approximately 80% for the first reading and improved to 90% for the second reading.
These results certainly seem promising for the use of multidetector CTA in diagnosing these types of injuries. Now let's delve into the discussion section to understand how the researchers interpreted these findings and what the implications might be.
Absolutely. The researchers concluded that positive contrast arthrography with multidetector computed tomography demonstrated clinically useful sensitivity and specificity for identifying meniscal lesions in this group of dogs. They also noted that while their likelihood ratios were moderate, they didn't reach the very high thresholds they had initially hoped for. So, their initial hypothesis was only partially supported.
They also emphasized the effect of observer experience and the learning that occurred during the study. The improvement seen in the less experienced observers after reviewing the scans a second time highlights the importance of training and familiarization with the imaging technique.
It's interesting that the training protocol they used was similar to one previously reported for board-certified radiologists with limited experience in CTA, and their inexperienced observers achieved similar sensitivity and specificity. This might suggest that the advanced image quality of multidetector technology is beneficial.
The researchers also discussed the reference standard used in the study, which was arthrotomy with probing and visual inspection by an experienced orthopedic surgeon. They acknowledged that arthroscopy is often considered superior for diagnosing meniscal lesions. They also raised the possibility that some false positive CTA diagnoses might actually reflect the limitations of arthrotomy in confirming very subtle lesions.
That's a valid point. If CTA can pick up something that's not readily apparent during an open surgical exploration, then it's not necessarily a false positive in the true sense.
Exactly. The study also compared the likelihood ratios of multidetector CTA to those reported for arthroscopic examination with probing in cadaver studies. They found that arthroscopy with probing might give higher positive post-test probabilities for meniscal injury, but could have worse negative post-test probabilities in certain scenarios.
The researchers also briefly touched on other imaging modalities like ultrasonography and magnetic resonance imaging. They noted that while MRI is the preferred modality in human medicine and has shown good results in dogs, its availability in veterinary settings is still limited, the costs are higher, and scan times are longer compared to multidetector CT. Also, MRI image quality can be affected by metal implants, which is relevant for dogs with previous cruciate ligament surgery.
And importantly, they point out that CT can often be performed under sedation, whereas MRI typically requires full anesthesia. Given the wider availability of CT and radiological reporting services, the researchers suggest that multidetector CTA appears to be a promising diagnostic tool for identifying meniscal lesions in dogs. However, they rightly advise clinicians to consider the cost-benefit ratio in their specific context.
They also addressed some of the limitations of their study. For example, the interval between the CTA scan and the surgical exploration varied, which could potentially lead to meniscal lesions developing after the scan in some cases. Also, the surgical exploration was not blinded, as the lead surgeon was also involved in the study, which introduces a potential for bias, although the subsequent measurements were done in a blinded fashion.
Another limitation they mentioned was that the volume of contrast medium injected into the joint was based on subjective joint distension, rather than a standardized volume based on body size. However, they did note that they didn't observe any contrast leakage, and the image detail appeared good in all cases.
Finally, the researchers reiterate the clinical significance of their findings, stating that multidetector CTA can be considered for assessing the integrity of the medial meniscus in dogs due to its clinically useful sensitivity and specificity and moderate likelihood ratios. They strongly recommend extensive training and familiarization with CTA images before using it in clinical practice.
This study provides valuable insights into the potential of advanced CT technology for diagnosing a very common and often painful condition in dogs. It highlights the benefits of multidetector CTA and also underscores the importance of experience and training in interpreting these images.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.